Researchers at Washington University in St. Louis looked at non-small cell lung cancer patients who had non-contrast chest CTs as part of their radiation treatment planning. So these researchers, they evaluated for coronary calcification. So I wanted to tell you what coronary calcification is. It's basically hardening of the arteries. It is the literally radiographic hardening of the arteries. So everybody who has lung cancer has chest CTs. And if you look in the right panel, that's a slice through the chest. They're cross-sectional images. Down at the bottom at 6 o'clock, that's the spine. You can see the posterior ribs coming out underneath it. And over the top, you see those white areas. Those are the ribs. So calcium is attracted to cholesterol plaque. And x-rays are very good at seeing calcium. That's why we see bone so well. And that's why we see the bones of the backbone and the ribs so well. If you look in the center of that image there, you see something that goes off at 2 angles there. That's not bone. There's not supposed to be any bone in the middle of the chest there. That actually are coronary arteries that are calcified. So this patient has hardening of the arteries and their blood vessels are all calcified from plaque there. And this is not subtle in this case. Most often what you see is a little eggshell rim of the calcium. In this case, it pretty much encases the whole vessel. But when we talk about coronary artery calcifications, that's what we're talking about. So this study from Washington University in St. Louis, patients, they're non-small cell lung cancer patients who had the chest CTs as part of their radiation treatment planning. And after adjusting for age and sex, the coronary artery calcium group was associated with increased risk for cardiovascular disease. And when you graded the amount of calcium, patients who had mild coronary artery calcium had 12 times the increased risk for major adverse cardiac events like heart attack. Those who had severe had 21 times the increased risk. So it's really important to identify coronary artery calcifications. So recognizing patients with a high burden of coronary calcifications allows for the implementation of aggressive measures to try to reduce someone's risk. And such patients would benefit from taking a low-dose aspirin a day, and they would benefit from taking a statin drug like Lipitor. So we would strive to get someone's LDL cholesterol under 100. So LDL cholesterol is the bad one. You got the total cholesterol, and then you have good cholesterol, bad cholesterol, triglycerides. LDL is the bad one. I tell people, think of L for lousy. So the lousy cholesterol is the LDL. So if you have coronary artery calcifications, you have heart disease already. When I see new patients in the office and I'm looking through their electronic medical record, I will scan their imaging section to see if they've had any CT scans. And I look in the reports to see if the radiologist mentions coronary artery calcium. You can see calcium in other vessels too. It's not just the coronary arteries. So sometimes I've had dentists send me patients because they're doing a Panorex view of the mouth and they just happen to catch the coronary artery and they see calcium in the coronary artery and they send them to me. Sometimes people do CT scans of the abdomen and pelvis. And again, you have major blood vessels, the aorta and so forth. You could get calcium in those blood vessels too. All those instances indicate that patients are at increased risk because they have atherosclerosis. And recently you heard about, you shouldn't take low dose aspirin for primary prevention, right? Because benefits don't outweigh the small risk of bleeding ulcers or bleed into the head if you take daily low dose aspirin. However, aspirin is indicated for secondary prevention. People who have coronary calcium, they already have the disease. So taking a daily low dose aspirin would be indicated in such people. Yeah. If you have coronary calcifications, you have atherosclerotic disease. So that would be for secondary prevention. But it is important for your doctors to pay attention to that because it's kind of a gimme. So the question was that it sounds like it's important that you all know whether or not you have coronary calcifications on CT scans, and it is. And one thing that I want you to leave here with today is the idea that when you are in the doctor's office, bring that topic up. Patients have all had CT scans, and it's a really easy thing to go to the last CT scan because that's the one you have to go to, the last one. Because if you had coronary calcifications on your most recent one, it doesn't matter what the other ones show. So, and if you don't have it on your most recent one, you don't have it. So all you have to do is go to the last CT scan report and have your doctor just go through it And if there's no mention of any kind of calcifications, then that's good. Okay. But just following up on the fact that a lot of times coronary calcium is present